Myself, JV and Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine in Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jaipur. In this series of lectures, we have been discussing about the various diseases related to the locomotor system. In today's lecture, we are going to discuss about another important disease condition, that is gout. Gout, this is also known as Gathia in normal language, and we also hear from many people that they are suffering from Gathia bile. So this is basically gout. In the last lectures, we have discussed about various important disease conditions of the locomotor system, like we have discussed about osteoarthritis, we have discussed about rheumatoid arthritis, we have discussed about reactive arthritis, psoriatic arthritis, ankylosing spondylitis, and so on. And today we are going to discuss about gout. What is gout? How it is caused? Who are the individuals more prone for development of gout? What are the clinical features with which the people of gout are coming to us? How to diagnose the case of gout and the management of the gout, also including the homeopathic management of gout. Now this is gout. Alright, this we know as Gathia. This is Gathia or the gout. This is basically a disease of the purine metabolism. Whenever there is a defect in the purine metabolism, then what happens is there is accumulation of uric acid. This uric acid gets accumulated in the joints that leads to the development of inflammatory changes. Let us try to understand what happens in gout. It is a disease of purine metabolism. This purine metabolism, this leads to the production of uric acid. This uric acid is normally formed and excreted via the renal system. Now what happens is, whenever there is excessive production or under excretion of this uric acid, this uric acids get deposited in the joints. Alright. So this purine, this is the normal product of metabolism. This is normal formed in the human body from its own metabolism and also from the dietary factors. So it is coming from the metabolism of the body and dietary factors. So what is happening in the case of gout? There is hyperuricemia. Now this is the inflammatory condition, arthritis, Gathia, inflammatory condition in which the uric acid is deposited. Now from where this urate is coming? From the dietary sources, from the endogenous production, and this leads to development of hyperuricemia. When this hyperuricemia is present, then it gets deposited in the joints. Now when it is deposited in the joints, what happens is, it is deposited in the joints and then it starts the inflammatory process. There are crystals of monosodium urate. Gout is characterized by the deposition of monosodium urate crystals in the joints. Therefore, it is also known as gout, is also known as crystal deposition disease. Alright, so crystal deposition disease, there is excess of monosodium urate crystals that are deposited in the joints. Now what happens? Who are the individuals that are prone for development of monosodium urate crystal deposition disease? Females, is to male ratio 7:1 to 9:1. We have, this is more prominent in males. Male is to female ratio is 7:1 to 9:1. That is, it is more prone in males. Females, those females who are postmenopausal are more affected with this disease condition. Now, as we have discussed, there is hyperuricemia that is seen in case of gout. So what happens because of this hyperuricemia? There can be the clinical features or the clinical presentation of gout. This consists of three parts. Number one, asymptomatic hyperuricemia. Second is acute gout, and third is chronic tophaceous gout. Let me show you the PPT of this disease condition, what we are talking about. This is gout when there is deposition of the crystals. This is more common in males in comparison to female. This I have already told you. There is hyperuricemia, and in females this is postmenopausal females are there. All right. Now, monosodium urate crystals that I have already told you. How these monosodium urate crystals looks like. This is the picture of the monosodium urate crystals, how they are looking like. Now, these crystals get deposited in the joints and they start the inflammatory process. Because of this inflammatory process, there are signs of inflammation and there is pain and swelling that is seen. Now, we have discussed about the three phases. Now, three presentations. There can be asymptomatic hyperuricemia, acute gout and chronic tophaceous gout. These are the tophi. You can see that these are the tophi that are commonly seen in case of gout. In this leg also, and in this hands and legs. So this is the tophaceous condition that is seen in case of chronic gout. Now, how the acute gout presents? In case of acute gout, what is happening is there is acute pain. Now, let us discuss about the clinical features. We have divided the whole gout into three: asymptomatic, hyperuricemic phase. There are no symptoms but only hyperuricemia, that is increased level of the uric acid. Acute phase, in which this is the most important phase when there is acute pain coming suddenly, especially in the great toe. The first metatarsophalangeal joint of the great toe, पैर का जो अंगूठा है, that is the first affected joint, and there is inflammation of the joint. The inflammation of the joint is known as podagra. Now, what is podagra? Let us try to see the picture of podagra. Look, this is podagra. Podagra is the affection of the foot that is resulting from the affection of the first metatarsophalangeal joint. So, this is the condition when there is acute pain. Acute pain, there is initially one joint is affected and there is severe swelling, warmth and dramatic pain at night. So, in the acute phase that we have just now seen, there is acute phase when the pain is coming suddenly. There is sudden pain, sudden onset, sudden pain coming at night. Alright, there is inflammation of the joint, but this pain is self-limiting, lasting only for 3 to 10 days. So, the acute phase of the gout lasts only for 3 to 10 days and then the pain subsides and patient feel normal. Now, the third phase is the chronic tophaceous gout. Let me show you again the chronic tophaceous gout. Now, we have seen the tophi. This is the chronic tophaceous gout when the tophi are present. What are tophi? Tophi are nothing but they are initially chalk-like material. They are initially soft and later they becomes hard. This is occurring in case of chronic arthritis. This is also known as tophi or tophaceous phase. Alright, there is formation of tophi in the chronic phase. Where these tophi are formed, these can be found around olecranon process, around the ankles, tendo Achilles, helix of the ear and other joints. So, this is the chronic phase or the chronic tophaceous gout. So, we have seen there are three phases. First, asymptomatic hyperuricemic phase when there are no symptoms but increased level of the uric acid. Then the acute phase that is characterized by podagra, sudden acute pain, severe pain that is coming at night. Chronic tophaceous gout when this acute phase is coming again and again and later on resulting in the formation of tophi or the calcaneous material. Now, what are the investigations? How to investigate a case of gout? Investigation, we all have discussed that there is increased level of the uric acid. There is uric acid level that is increased. Second is demonstration of the monosodium urate crystals in the synovial fluid. So level of uric acid is increased and demonstration of the monosodium urate crystals and X-ray findings. X-ray findings are important. Here there is destruction of the cartilage, bony erosions are also present, and ultimately fusion of the joint is also seen. Next we come to the management part. How to manage a case of gout. Now we have seen that there are three phases: asymptomatic hyperuricemic phase, there is acute phase, and there is chronic phase. So in asymptomatic phase there is no symptoms, so we just have to monitor the patient and we have to give those drug substance which can lower down the uric acid level. So uric acid lowering agents are to be given. Second, we have discussed in the acute phase there is pain, acute pain, severe pain, so we have to give analgesics, NSAIDs. These have to be given, that reduces the inflammation and reduces the pain of the individual. Because this is gout, so colchicine is the drug of choice that is also given for the treatment of the gout. And glucocorticoids that reduces the inflammation. They can be oral and they can be systemic. They can be focal or systemic. Alright, these glucocorticoids can be given. So let us see from the PPT also. Chronic tophaceous gout. These are the three gouts that we have discussed. This is the acute gout, podagra formation. These are the precipitating factors: trauma, surgery, and excessive ethanol consumption. Now, this is the diagnosis. We have to check for the uric acid, synovial fluid analysis for the presence of the monosodium urate crystals, urine for uric acid, and screening for the high risk factors. Now, what happens with this uric acid? Whenever this uric acid is present in the body, what are the effects it can cause? It can attack the joints and can produce the acute pain. Other than that, it can remain silent, that is asymptomatic phase, acute and chronic tophaceous gout. This uric acid can also, because this is excreted via the kidney, so this can produce renal manifestation and ultimately leads to renal failure. Alright, and apart from this, this can also produce cardiovascular complications, especially atherosclerosis. Alright, so these are the complications. In the complications of gout, not only the joints are destroyed, but also kidneys and heart is also affected. Now these are the disease conditions which resembles gout: septic arthritis, reactive arthritis, CPPT disease, and rheumatoid arthritis. Now the treatment, this I have already told you that in the acute, in case of asymptomatic hyperuricemic phase, we just have to give those drugs that lower down the uric acid level. In the acute phase, we have to give analgesics, NSAIDs, colchicine, intra-articular glucocorticoids, systemic glucocorticoids, and uric acid lowering agents. Next, we come to the homeopathic management. What are the homeopathic medicines that can be given in case of gout? There are various important homeopathic medicines which can be given in case of gout. Homeopathy treats the symptoms, the disease condition on the basis of symptom similarity. We have lots of good medicines that can be given in case of gout in all the three stages. Number one, in the asymptomatic hyperuricemic phase. Second is in the case of acute gouty phase, and third, tophaceous gout. In all three cases, homeopathy offers a very good treatment. Number one, in sudden acute pain, aconite can be given. Aconite lower down the pain when the pain is coming suddenly. Belladonna to reduce the inflammation. Then colchicum. We have seen that colchicine is given in treatment of gout. So colchicum offers a similar response in homeopathy. Then we have Bryonia alba when the pain is worse by movement. Then we have causticum. We have rustox. We have rhododendron. We have sulfur to reduce the inflammation. Apart from this, we also have some nozones that can be given, like medurinum. These are the drug substances or the medicines that offer very good result or relief in the patient. So let us again revise what is gout from the PPT. Now gout is nothing but a chronic inflammatory disease condition. So it is an inflammatory arthritis with a high level of uric acid. Always remember, this is again profile. This results from high level of uric acid in the blood. It causes sudden severe episodes of pain and tenderness that we have seen, redness, warmth and swelling. So the joints become very much inflamed, warm and swollen, and there is hyperuricemia. This hyperuricemia is the key to understand the gout. So this was all about gout. I hope you must have understood gout properly. In the next lecture, we will be meeting with a new topic. So this was all for today. Thank you very much. Have a good day.